let's roll on C. Scene 103, take one. Here we go.
Is there a camera up there? My name is David, and I'm here with my sister Esther.
First name, right? Just not. Sorry.
Wesley, I'm with my knucklehead brother.
Oh, okay.
My friend Nuffy.
My boyfriend, Doug.
I have been 100% into getting vaccinated, and then I asked you, and you hesitated.
Yeah.
There's not that long-term research out there yet.
How do I know the way I'm gonna respond to it?
They're saying that the vaccine is 99% effective, right?
Where are you going with this?
99 of those people, they survived. They're great. So you ask me what?
I don't care, Wes.
What about the one dude?
I feel like I'm okay without it.
The reasons are frustrating, like when you say, I'm afraid of needles. You are a grown-ass man, like, you're not afraid of needles.
No, I am.
I know you are.
I'm just saying, like, everyone has a right to make their own decision.
But why would you want to take that risk?
All these shots after shots, like, I don't want to have to go through all that.
Compare that to having to be in a hospital for a month.
They're
So, like, think
also
about this,
asking
look.
you to do your research, to go see your doctor, ask your doctor questions so that you can protect yourself and protect the strangers that are
In
also.
a year or two, I would think about taking it. I'm just saying, I don't want to be on the front line.
But you're human.
But it's-
You're gonna make a mistake.
Can you imagine being the person that goes to somebody's house and gives them a virus that kills them?
What if you're one of those cases, you know, and you end up in the hospital?
Yeah.
That's what I'm scared of.
You're the closest person to me. It makes me worried.
I want you to get the vaccine because I want you to be safe.
Your eyes look really sad right now. I'm tired of taking care of patients and like being just the last person they see before they die. I have to be the one to share those last words with family members.
If you was to die, man, that would literally kill me, man.
I hug you.
Yeah.
If it made you feel that way, bro, I'll probably do.
Love you. Love you too.
Good evening. Welcome to Community Ministry of Prince George's County. Community Ministry is a 48-year-old faith-based organization, nonprofit organization that is based here in Maryland, Prince George's County, Maryland. As Executive Director of Community Ministry, let me thank you for joining us tonight. And let me also take this opportunity to thank our Dr. Phyllis Slade Martin, who is the organizer of this event tonight and the project director for our local COVID partnerships grant, which is offered by the CDC Foundation in support or in collaboration with the Robert Wood Johnson Foundation. Let me also thank our distinguished panelists for appearing tonight and supporting us. We look forward to all that you have to share with us tonight. And we thank you, Olivia, for serving as our moderator. Our first speaker of tonight is going to be Nate Woodard, who is a doctoral student at the University of Maryland and a CMPGC Health Programs Officer. Nate is also part of the Behavioral Health organization or department at the University of Maryland, and we welcome him to provide us a brief overview on COVID tonight as well. We're thankful for Olivia Stanford, who is a research program coordinator for community outreach and engagement at Johns Hopkins University, assigned within the Sidney Kimmel Comprehensive Cancer Center. She helped moderate and run for the multi-episode web series that we conducted earlier, or that she conducted, Conversations with the Community, which aims to help educate people in various cancer topics through talks with community members, survivors, and healthcare providers. We thank you, and our next person you will hear tonight will be Dr. soon to be great Dr. Nate Woodard. Thank you.
Good evening, everyone. Thank you so much for being here. My name is Nate Woodard. I am just going to give a brief opening into some information about COVID-19, some basic information before we get into some details from the panelists for tonight. And so I have a short presentation for you. If I could get share screen privileges, I will share that with you all, and then we'll get started. Okay. So of course, tonight we are here and we'll be talking about COVID-19. Colloquially, many of us have heard about this being called coronavirus. And like I said, the information that I'm presenting is fairly basic. So many of us have probably heard this, but want to make sure that we're all starting from a common ground as we talk more and more about this disease. So COVID-19 is a disease that affects the respiratory system, these being the organs that we use to breathe. And it is spread most via respiratory droplets when people cough, sneeze, or speak. And there's some recent research about aerosol spread via the air for COVID-19 as well. It is unknown how the disease will affect each individual person, but infection can, and illness from the infection can range from mild symptoms to severe illness and death. So I'm not going to read these symptoms word for word because you can all read, and I think many of us are familiar with the symptoms of the disease by now, but they're very similar to fever-like symptoms. And they often appear anywhere from 2 to 14 days after someone is exposed. And so this period where people are not showing symptoms, or sometimes people never show symptoms, these are huge concerns as we think about individuals who, feel okay, but are carrying the disease and are not being tested because they feel okay, and then are passing the disease on to other people. So things that we can do to help stop COVID-19, again, I'm sure we've all heard about these, but being sure that we're wearing masks that cover the nose and the mouth, avoiding close contact with others and staying 6 feet apart, which is about 2 arms lengths, avoiding crowded and tight spaces, and then washing hands with soap and water. And that one's super important and something that we should be doing even outside of the COVID-19 pandemic, being very conscious of our cleanliness and hand washing specifically. Using hand sanitizer when we cannot wash our hands, being sure not to touch our eyes, nose, mouth, especially with hands that have not been washed. Cleaning and disinfecting surfaces, particularly surfaces that are touched frequently, and then getting vaccinated, of course, which we will talk about tonight as well. So some brief benefits of vaccination can help protect you from COVID-19, including from COVID-19 variants. There's some evidence to suggest that will help create an immune response in your body against the virus, so help us fight off the virus, and can help us from getting severely ill with the illness, even if we do get COVID-19. So hopefully prevent severe illness and death. And so that is my very, very brief introduction, and I'm going to pass it off so that we can get into a bit more detail about some of these things.
Thank you, Nate. As always, it's always good. I'm glad you started that because I know I needed a little refresher after so long in the pandemic. I know I carry my hand sanitizer with me, but I might reach for my eyes. So thank you for the reminder as usual. Hi, everyone. I am your moderator tonight, and I can't thank you enough for joining us today on Reverend Dr. Martin Luther King Jr. Day. Just to begin, I'm honored to welcome our panelists. First, we have Dr. Jade L. Ranger. So Dr. Jade L. Ranger is originally from Bowie, Maryland, and she graduated from Hampton University with a doctorate of pharmacy in 2012. After spending almost a decade of her career working with big chain pharmacies, she, along with her husband, who we'll introduce next, Dr. Henry Ranger, whom she met in pharmacy school, opened the Prescription Shop, a full-service mom-and-pop pharmacy in March of 2019. So together, they have impacted the greater Williamsburg area by not only providing patient-centered care, but also engaging with their community. Along with her many roles, she has also added author to her resume with the release of her newly published book, Mustard Seed Mentality, Unscripted Pearls of Wisdom from a Wife, Mother, and Entrepreneur. Thank you so much for joining us today. Next is, of course, her husband, Dr. Henry Ranger. Dr. Henry Ranger also graduated from Hampton University School of Pharmacy with honors in May of 2011. Since graduating, he has relocated to the Williamsburg area with his family and have become extremely active in the Williamsburg community. In March of 2019, as I mentioned before, him and Dr. Jade Ranger opened up the Prescription Shop. And this full-service independent pharmacy, Dr. Ranger prides himself in being above and beyond for not only his customers, but his community. In fact, his motto is, every pharmacy has medications, but what sets them apart from one another is the customer service that is provided. Wow. But Dr. Ranger is also a member of various professional and service organizations in his community. Thank you so much, Dr. Henry Ranger. And last, we have Dr. Suyana Linhalis Barker. Dr. Linhalis Barker holds a doctorate in public health from the Oswaldo Cruz Foundation and a master's degree in social psychology from the State University in Rio de Janeiro. Prior to serving as La Clínica del Pueblo's Chief Program Officer, Dr. Linhalis Barker served as La Clínica's Senior Director of Health Equity and Community Action. Dr. Linhalis Barker has always believed that healthcare is a fundamental human right and has focused her career on ending health disparities related to poverty and discrimination. As the current Chief of Programs and Community Services, she is responsible for overseeing the design, implementation, and evaluation of programs that are culturally and linguistically grounded. Thank you all for joining us tonight. Those are our three panelists. Thank you so much. Yes, so before we get to these conversations that I'm sure we're all excited to hear about, I just wanted to ask each of you to provide a brief opening remark, about our program's theme, which is, where do we go from here? The persistence of hesitation, myths, and misinformation about COVID-19. If you don't mind starting, Jade, if you don't mind taking us off from there.
Good evening, and thank you all for having me. I want to say that where we go from here is hopefully getting on one accord. We are heading into year 3 of this pandemic, unfortunately, and I feel like it's because there's been so much misinformation, so many people who are uncertain, people who are just completely misinformed, and it's caused a lot of fear. And so what that has turned into is people not making, decisions that would essentially be more proactive versus reactive. And so I think that once we all are able to kind of decide that either we're going to, sail together or sink together, we're going to unfortunately continue to see, these different variants come about. We're going to continue to kind of be in this state of limbo and not really fully be able to move forward. And so I'm hoping that where we go from here is deciding collectively together that enough is enough and we are ready to move forward on one accord.
Thank you. Thank you for your brief opening remarks. Next, if if Henry, if you don't mind giving us some brief opening remarks as well.
Absolutely. Good evening, everybody. I'm just humbled to be here. Jimmy mentioned the esteemed panelists. I feel like, everybody else is esteemed and I'm just kind of that other guy, but it's all right. But as a Black male in America, I personally, I understand the hesitancy. I was hesitant myself early on. I had to educate myself and, like I've been having to do for a lot of my fellow, African-American males, I've had to educate them on a daily basis, because we've been victims to so many different injustices, throughout history. So like I said, I feel like I'm kind of obligated, in that role, because as males, so many of us are hesitant just from a healthcare, standpoint in general. People, males don't want to go to the doctor, they feel like we're big and macho. So constantly, it's a situation where we're avoiding the healthcare system as a whole. So when it comes to the vaccine, that's just, again, yet another hesitancy that, people could, basically be subject to. So, but the facts are in the pudding, showing that the unvaccinated people are the ones that are still being affected by this. So hopefully we go from here and get vaccinated. So again, I'm excited to be here.
Thank you, Henry. And then Sayana, if you could give some remarks as well.
Yes, I'd like first to say thank you for the invitation. It's just an honor for me to be here in this day, celebrating and remembering and being with the African American community. I think as Latina and having grown up in Brazil has incredible, it's very strong on me, this idea that we need to be together to think a solution. And when we think about all the difference that we face and all the separation that we face in general, being here today for me is an honor to be invited to be here to think about with all of you, how can we have a community that understand COVID as a collective problem, not an individual problem. Of course, every time that we feel afraid of something is because we know something in a personal level. But sometimes the personal level is what we learn also with the collective or the community has been giving us from the good and for the bad. So I'm honored, I'm happy, and I wish I could just have so many good things to say. I think we're going to say things today that's not that good, but basically because we need more engagement of everybody. So that's it.
Well, I as you all have said in your opening remarks, I'm excited to just get into this conversation. You all said some great stuff just to touch on. So I guess the first question I want to ask you all starts with a quote from Dr. Reverend Martin Luther King Jr., because we can't start this conversation without focusing on today. And here's the quote. The ultimate measure of a man is not where he stands in moments of comfort and convenience, but where he stands at times of challenge and controversy. All of you have touched on that in the times we're living in. So in the times that we live where, we face state governors challenging presidential masking mandates, and in the constant controversy about boosters and variants, I have to ask you all, where do we go from here? How do we process these myths and misinformation? Yes, I'd love for all of you to address this. Jade, if you don't mind sharing your thoughts first.
So I would say probably the myth that I would like to touch on the most is that I've seen so many people or patients kind of note that, oh, why do I need to get the vaccine? Obviously, all these people I know who've gotten the vaccine, even some of them who've gotten their booster shot, are still coming down with the virus. So why is it relevant? I mean, if we're all going to get it anyway, who cares? What difference does it make? And I think the thing that I really want to drive home as it relates to vaccines as a whole, there is no 100% guarantee. Whether you're getting a shingle shot, a pneumonia shot, a flu shot, it does not guarantee that you will not come down with the illness. The purpose of the vaccine is to give you protection. And so we're trying to prevent people from coming down with symptomatic disease, meaning that now you're requiring a hospitalization or worse, death. So when I have these conversations with people who are hesitant because they feel like it doesn't matter anyway, people I know who got the vaccine are still getting sick. When you compare the experiences that people are having when they're getting sick, it's much different. So for someone who's received their booster vaccine, yes, maybe they will still feel ill, but are they going to be more mild or minor, cold and flu-like symptoms where they can take, something over the counter and maybe they're uncomfortable or a little under the weather for, 2-3 days and they're able to bounce back? Or are they going to wind up on a ventilator? And I think ultimately, no, everyone's not going to wind up on a ventilator or die just because they didn't get the vaccine. But the problem is you don't know what your experience is going to be. And we've seen so many, people from various backgrounds have extremely different experiences. And so whether it's someone who seems like they're fairly young and relatively healthy that we've seen succumb to the to this virus versus someone who maybe is older and winds up being okay, you don't know what your experience is going to be until you come down with COVID, and you don't want to find out the hard way. So the myth that I definitely want to try to dispel is just the fact that, again, the vaccine is working even with the breakthrough cases. So just keep in mind that when you're getting the vaccine, when you're getting boosted, you are protecting yourself.
Absolutely. Like you said, it's not a 100% coverage. I'm learning that too. I know I definitely grew up thinking I got my vaccine, I'm perfectly safe from the flu. But like you said, it's building the protection. So going to that question, I guess I want to ask Sayana and Henry. Sayana, is there a particular myth or misinformation that you would like to debunk?
Yeah, I think one thing very important is a lot of people is doubting this vaccine because it was so quickly, right? When we had this vaccine. So this was like the development of this vaccine. I mean, the multiple vaccine that we have now was such a quick one that people think this is just like experiment, right? This is experiment and I should not dare to take this. I want other people to get that first. So I'm going to be at the end of the line. So I see what's going on. And this is very important to explain. We never seen before in the development of a medication so much money put into the trials. So the trials are all the experiments that researchers and developers do before they get approved to give the vaccine to us. So the trials means a lot of people is invited voluntarily to participate in studies. Now we have more protection of human rights into it. So people really has to sign a consent and understand the risk. And people are invited to participate on those tests. So they give vaccine to some people and they give a placebo to the other people. So you have like two groups of people, one get the vaccine, the other one don't get the vaccine. And they follow this group of people until they figure out if the vaccine is working or not, if what they develop is working or not. I bet Jade and Harry can explain this better because they're pharmacists a little better than I do. Maybe they can reinforce that. But what is that? That's very important. In the beginning of this pandemic, because the lockdown was such like economic complication, a lot of government put a lot of money on those trials. So you had the people developing the vaccine, and a lot of government from US, from Europe, from other countries put a lot of money on those researches. So quickly enough, we start having results that the vaccine was safe, right? The vaccine was not giving people much problem as the disease in itself. There is always one or two situations that individual body can react in a different way. But what we learn is it's pretty safe, right? It was pretty safe for the majority of us. And it's something for us to talk about this a lot. Why this vaccine, why we have this vaccine so quickly, right? So fast, is because it was public investment. Governments gave money to the companies. Those private companies now, they got the money from the government to develop those vaccines that now we know that's safe. And I think it's important to say that. We are not dealing with a medication who can kill us. We are dealing with a medication who can really protect us against being killed. And we know who is dying, right? We know who is dying. Those who are dying were those who could not stay in your home, working, protected, right? those who trust your provider are not dying. The people who is dying are people who are left behind already, people who could not trust the health system before, who could not feel welcomed in the health system before, and also more vulnerable because they have other disease because of that too. They have diabetes, they have hypertension. This is also people left behind by the system that didn't welcome them to take care of their health. And this is true, this is not a myth.
The fact that the healthcare, I think coming from being an American girl myself, I love my country, but so when learning these hard truths, the fact that not everyone is covered equally with the same quality of care in America is hard. It's a hard pill to swallow. But as people in the health sector, I know that's something we have to face. Now, what about you, Henry? What is a myth or what is a piece of misinformation if Sayana or Jade, if they haven't touched on it, what's one you'd like to address?
I would have to say it's going to be in, I guess, it's going to be correlated to the Pfizer and Moderna vaccine, with them both being mRNA vaccines. You know, a lot of people talk about how, oh, I've heard that it's going to alter my DNA. This is, I mean, the furthest thing from the truth. Granted, yes, it is a new technology for vaccines. These are the first two vaccines in which we've had this style, you know, of immunity or protection from, you know, the vaccine like this. But, you know, at the end of the day, you know, it's still basically all it is showing your body a different way to develop the protection. You know, the traditional vaccines like the Johnson & Johnson vaccine is more so exposing your body to, like, they're calling it like an attenuated or a dead strain of the virus so that your body can then develop its own immunity to it. Where the messenger RNA vaccines, they're teaching your body how to make its own protection against it, opposed from exposing it to a little bit of the virus. At the end of the day, yes, you know, Sayana talked about, you know, the myth of it being something that came to the market quickly. But like she said, there was a lot of people investing heavily into this because it was a big deal. So like I said, at the end of the day, vaccines have shown to protect people. You know, we have diseases and conditions that have basically been eradicated due to vaccines. So you definitely have to use this, you know, this is a tool in your toolbox that, you know, we've been blessed to be able to use to protect us. So yes, to dispel the myth of it changing your DNA, that again, that is completely false.
No, I recently saw one of the Marvel movies, and I'm not going to spoil anything for any Marvel heads, but I just know I've always wished if I could be a superhero, but I'm glad you dispelled the fact that it doesn't change your DNA. So sorry, we won't be any superheroes anytime soon, y'all. But all of you touched on one word stood out to me: protection. All of you said protection. I think we thought we had it down packed. As you touched on, Jade, we're going into year 3, which no one thought that would happen. So I guess what I want to ask you is, how do we protect ourselves with these variants constantly popping up? How do we protect ourselves? So I guess I wanted to ask, I want to start with you, Sayana. I wanted to ask you if you can touch on this. What is the impact? What impact is Omicron and the different variants having on the people you serve in your community?
Yeah, I think the Omicron, the important to think is like is more transmittable, right? Means you get more vulnerable if you don't use any protection, right? So that's what more than ever is very important. The mask. Mask is incredibly good protection, and if you could avoid the cloth mask, would be good, right? Even though we know the cost can be prohibitive, but if we could have surgical or some of the KN95, those are a little bit better from protection. So masks is really good. Also, if you're able to, if you have available, and you can also ask for that, to have also rapid test, right? It's important to know that the rapid test can pretty much predict if you are shedding a lot of virus, right? Because it's not as sensible as the other test. But if you turn positive on a rapid test, means you should stay home. So this is very important, because then we would have less people sometimes not knowing, but maybe transmitting the disease. So I don't think the Omicron is really different than what we have so far, with the difference that is more transmittable. And of course, more people being vaccinated, there is more chance that our defense would have the result of being exposed to Omicron less danger, right? And that's what would be very interesting for all of us to be vaccinated. Because at this point, even with some variation of the virus, if we are vaccinated, we are going to have symptoms that we can manage, right? Not symptoms that we can overflow, that we can make the hospitals crowded. And important about hospitals being full of people with COVID is bad for everybody, even for us who are vaccinated or stay home, right? Because I can stay home and I'm vaccinated. I don't feel I'm not going anywhere, so I'm not going to, this is not my problem. But then I have a car accident and I end up in a hospital, and the hospital is overcrowded. It's not good, right? Things happen to us. We can have a heart attack. We can have an accident. We may end up needing a hospital. So we need hospitals not full of people dealing with a disease that can be preventable. So I think we should think about that on protecting ourselves. So we shouldn't be afraid. We should be cautious. Don't be afraid, right? Be cautious. And I think we can keep going this way.
Thank you. Thank you so much. So I'm going to go back to the word protection, because I know we're all in different parts, coming from different parts of the country and maybe even the world here. So, but I wanted to ask definitely Doctors Ranger, Jade and Henry. So for those of you who aren't aware, the new governor of Virginia, Glenn Youngkin, as of 2 days ago, he wants to change the masking mandate for public schools in Virginia so that students don't have to wear a mask. And note, I said public schools. So I wanted to ask you both, Jade and Henry, since you work in the Williamsburg area, you are in the state of Virginia, what implications do you see this having on the communities you serve? How can we protect ourselves with this going on?
What's most unfortunate about the mask mandate recently being dropped is that what it is doing is making people who were already going to be the most vulnerable more at risk. And what I mean by that is that if you have parents who are currently championing for their children not to be wearing masks in schools, likely those are the same parents who don't believe in getting vaccinated. So even if their children are of age, meaning that they're 5 years old or older to actually receive the vaccine, their parents haven't been proactive in that way. So now what you're going to have are kids out here who have zero protection and won't even have the protection of wearing a mask. And that's a very dangerous game that our local government is playing, that they're putting politics, unfortunately, above the safety of our general public and population. And I'm not quite sure what the end game is, because we already have a healthcare system, whether we're talking about urgent cares, hospitals, healthcare workers, teachers, everyone is being completely overworked. Folks are dropping like flies. And instead of doing things to try to empower these people and help them, we're doing things to make their job that much more difficult. And, thankfully, it looks like it's going to be, a school district by school district. They're going to have the opportunity to make their own decision. We were saddened to hear that one of our good friends, her son's school district, immediately decided to drop it. We were thankful when we received the email for our boys that they are going to stick with the CDC and the Virginia Department of Health recommendations and guidelines. And so, again, I think what we're going to see is just people continuing to get this virus and things to continue to spiral out of control. And it's unfortunate because we could be taking proactive steps, and instead Like I said, we're putting politics over the people, and that's really unfortunate.
I mean, you said so much in your statement, just from how, and I know Sayana, you touched on this earlier. You said the most vulnerable are more at risk. So they were already vulnerable before. Again, we don't want to hear it, but there are people they're not getting the quality care or equal access to quality care. So they're now more at risk, and these are our babies, our kids. So I don't want to get political either. So thank you so much. But since you did talk on younger children, in particular, your parents, Jade and Henry, Henry, if you don't mind, do you mind just discussing what is the current information about the vaccine for children ages 5 to 12? Because I personally don't know that much either. What are the side effects, the benefits, and what kind of attitudes have people come to you as a pharmacist?
Well, I mean, I can honestly say as soon as we got the vaccine in the store, we had people that were, pretty eager to get their children signed up for it, which is a great thing. The more people that are vaccinated, the better, so that we can hopefully put an end to the spread of this virus and, get on the other side of things. But from a side effect standpoint, it's been great. I mean, for the most part, I've heard of children that have experienced absolutely nothing. I mean, we gave our 8-year-old, he was actually the first kid that we immunized when we got the vaccine. I mean, we wanted to kind of get out in front and lead by example and, show, hey, we're comfortable enough giving this vaccine to our child. You guys need to do the same thing. And he barely said that his arm was sore, which is, basically the most consistent side effect that people usually experience. The arm soreness is something that you usually can't avoid. It's just something that's going to happen. We have had a couple cases in which some children have had an upset stomach, just feelings of lethargy, just feeling a little, sluggish, tired. A couple reports of headaches, but I mean, outside of that, I mean, that's been it. It's been nothing like, the things that we've heard from adults that, like myself, I definitely, I had some side effects from the vaccine, but at the end of the day, it was totally worth it, because, granted, where we definitely still carry ourselves in a way in which we're, socially distancing, we're masking, even though, masks aren't required in certain certain places. If you've been fully vaccinated, I still wear my mask inside the grocery store, because again, we're taking it serious. And, again, we're just trying to do whatever we can to, just let parents know that it is something that it needs to be done. It's important, because thankfully, we haven't run into a situation where we've gotten this mutation from the virus that the vaccines aren't protecting us against. Omicron has, where the side effects are, pretty mild for those that are vaccinated, that's a blessing. We don't know if that's going to be something that's going to continue. So that's why we have to be vigilant and try to do what we have to do to get vaccinated.
Thank you.
Olivia, if I could just, sorry, really quick piggyback. I wanted to mention something, just because I don't want to be misleading as we're talking about underprivileged communities and populations. When my husband mentioned that we've had an influx of parents, I mean, they were beating our door down wanting to get their kids vaccinated. I do want to mention, we live in Williamsburg, Virginia. It is a predominantly white community that is pretty well-to-do. And so you have, in general, we do very well with vaccines. Patients are very proactive coming to get their flu shot, shingle shots, pneumonia shots. Last year we did 10,000 vaccines all in all. So we do a ton of vaccines, and in this area, people are very proactive about it. That's not the case everywhere else. And so likely people are seeing different feedback, and you're going to have those that are going to be much more hesitant to get the vaccine than what we saw here in our community.
No, I thank you for addressing that, Jade, and thank you, Henry. I'm glad you touched on that. Each community is different. How some people are hesitant, or like you said, they were knocking down y'all door, like, give my baby this vaccine yesterday, please. Thank you. You're welcome. So I guess I kind of want to ask Sayana, if you could touch on when the vaccine became available for children, and of course, what kind of things came up from the communities that your organization, La Clinica, what kind of things did you guys have to face when with your communities and everything?
I think the fact that we hear less kids in the hospital made some parents like maybe it's not necessary, right? But what we'd like to say is like, if it's just one kid in the hospital is bad. If we have a way to not let that kid go to the hospital, we should do as much as we can. I think the protection with kids is always the protection of the future. So families are really concerned that maybe as an adult, I can take if something goes wrong, but I don't want anything goes wrong with my kids. So there is a lot of explanation about that would not be allowed if was a risk for the kids, right? I mean, again, bringing back the studies, the investment that was done, so we would have information about this, about the risk for that. I think the one thing that's important for us to think is, and other disease was that, like chickenpox, for example. Chickenpox is almost not a problem anymore, right? Chickenpox was, I mean, 4 million people per year was having chickenpox before vaccination. So now we have such like a protection against it that you can get a vaccine when you're a kid, and then you don't have the virus going around very often. So this is what we can get also with, we hope, with COVID, right? That we're going to make having so many people vaccinated that the virus becomes something that's not that important or that serious as we have now. For that, we need a lot of people having protection, right? Because having protection, like polio was another disease that, I mean, we had so much of it before, and now we don't have this problem anymore. So I think we can envision that for the future. For now, what we need is really, I think, mask. I'm so sad with what's going on, right? With this political perspective of masks. Masks should be a simple thing that everybody should use, and the message should be just one. We become such a complication. Mask is such like an easy way. I mean, I don't know, you all had to prevent HIV or had public health to do HIV before. Hard was convincing people using condom. That was hard because that was such like a complication. It's such like an intimacy of people. In a private, masks is really easy. I mean, it's easy. Like mask, you put a mask to go in a supermarket, when you get out of the supermarket, you take the mask off. This is not a big deal. And I think we should tell more about this. Like vaccination should not be a big deal and masks should not be a big deal. But for that, we need everybody speaking the same language, right? Everybody has to have the same message. I think what's not being helpful for us is so many different messages going around. So many leadership doubting basic science, right? We're not talking about complex science, we're talking basic science, right? Mask is basic. Mask is what doctors, nurses, dentists use when they have to take care of patients who have a disease. So this is not really complicated. It's not to be debated about this. Like this is like common sense. And we make a debate about common sense like mask. And I think this is the part that's sad, and all of us could change this. All of us, we listen this today, we have to normalize it, have to normalize mask. This is not a big deal. It's just like, if I'm getting closer to someone, if I'm in a crowded place, mask can be the way, and it's working. And I do think that when we think about this disease, not being my problem, but being my community problem, is what could be really change this game, right? This is not my problem. This is my community problem. And my community, in my case, is not only the Latinos, right? The community that in my case is the whole area where I live, is everywhere where everybody that's where I live, it's my community too in this case. And I think it's a point for us to integrate, to share our needs, and also to share our hopes, right? And take care of each other. So mask, social distance as possible, and vaccination can be a collective action to change this.
Oh, thank you. And
Olivia,
so,
just to piggyback on what Suyana was saying about masks, just quickly, you know, our flu seasons have basically been non-existent. And the difference is It's not that, people have been getting the vaccine. People have been getting the flu vaccine, for years. It's the masks. The masks have shown to be effective. I swear in 2020, like we hardly like all of our Tamiflu medication that we had at the pharmacy, I had to send back because it expired. Like we didn't dispense one of them. And even in 2021, granted flu season is, still here. We're in the midst of it now. We still have hardly used any Tamiflu. We haven't seen it. It's not that flu isn't there. It's just the fact that the better hygiene practices, the masks, it's showing us. I mean, it's right there, clear as day. So yeah, just my little 2 cents to add right there.
And what a set of pennies that was to the bank. I mean, seriously. And I always, and this is my quick little tidbit to add on, I will, at times I was like, oh, these masks, it's too many. And then I remember seeing someone sprinting at the park while wearing a KN95. I will never forget that. This was in the summer of 2021. I was like, oh, well, I have no excuse. I'm just walking to my car from the store, getting my chips, and they're wearing a KN95 sprinting. Mask, it's okay. I can't. Well, thank you all for the insight. So I see we're starting to get questions from our audience. And so before we touch, so let's see, the first question is from Jimmy Slade. Jimmy Slade wanted to ask all of you. So he said, first to Henry and Jade, he says, in foreign countries, pharmacists are working excessive hours offering the vaccines and their services. So are you experiencing extra workloads in giving the vaccine?
The answer to that is a one-word answer. Absolutely. We have seen a major influx as it relates to just the work ethic that we have to put out day in and day out. Our staff has grown times 2 additional employees over the course of the pandemic, where we see a lot of other industries, they are struggling to get, restaurant workers or, and wherever. For us, we've had to acquire more people to keep up with the growth. And so it has been extremely challenging at times to keep up with it, because in addition to all of these vaccines that we're now administering on a daily basis, we still have to fill our regular prescriptions. We still have to do our compounding, meaning making prescriptions from scratch. We still have to fill our pill packs for patients. We still have to do our deliveries. So it has definitely caused additional responsibilities, additional stress, especially in the beginning. We were one of the first local pharmacies in Williamsburg, Virginia to receive the vaccine, period. We started administering the vaccine on January 25th. And for the first month or so, we were doing about 110, 111 vaccines per day. And that's on top of everything else that we were doing. And so it caused us a lot of fatigue. Thankfully, our community completely rallied around us. I mean, people were being extremely gracious, extremely patient. They were bringing us lunch, dinner, sweets. They were offering words of support. They would call and text and check on us. So we really appreciated it. But again, to something that Sienna mentioned earlier, it comes back to the greater good of the community, because this is not a you problem or a me problem, it's an us problem. And it affects all of us. And like I said, whether it's the teachers being burnt out, whether it's the medical staff being burnt out, whether it's the parents being burnt out, trying to keep up with the back and forth with the virtual learning, you would think that all of the stress over the last 2 years and some change would make people think like, hey, we're all exhausted. What do we need to do at this point to make sure that our kids are in school every day full time, safely, to make sure I can go to work and we can resume some sense of normalcy? And while people keep saying they want to get back to normal, they don't want to then do the steps. It's just like saying you want to lose weight, but not exercising and changing your diet. It's not going to work. They go hand in hand. And so you're going to have to, at some point, make the decision that you're going to take proactive steps.
Another word that all of you have said tonight is community. And like you said, Jade and Sayana, this is not just about one one person. This isn't about just you and me. This is us. We're in this together. Year 3. I don't know how many more. We don't want a decade of COVID. We don't want to bring in 2030 with COVID, guys. Come on. So just bringing it all back to focus. And before I ask my next question, I want to thank all of our audience for watching and tuning in. Please submit your questions. I'd love to have any concerns for our amazing panelists, Jade, Henry, and Sayana. If you want to ask them something, please put it into the chat and I will be more than happy to ask them. But my last question before we get to our audience questions is just bringing it all back to the focus of the importance of this holiday. Reverend Dr. Martin Luther King Jr., well, he has a day named after him for a reason. So I wanted to ask for the national theme of this day. How do we shift our priorities to create a beloved community that reflects Reverend Dr. Martin Luther King's ideals? How do we do that? How do we make the community that's just not you and me, but us?
There is a quote from Dr. King that I'm not sure if he said that, because internet, you have so many things going on that I'm not sure. But it's a quote that I'm going to read here. It's a quote that he said, right? I hope he said that because it feels very smart. So all forms of inequality, injustice in healthcare is the most shocking and inhumane. So feels like him saying that injustice in healthcare is the lack of really us having humanity, right? I mean, I think one thing that unfortunately sometimes we think that being healthy it's a merit, is because I did right and I deserve being healthy. Health is not something that you deserve, right? Health is something that you have a right to have. Is not because you behave well, you're going to be healthy. Of course, we know there's so much information and things that you can do to be healthy, like get vaccinated for COVID. So there's so much information for us to be healthy, but also being healthy is you feel that you can be cared of, right? I mean, and care of means also access to healthcare, access to caring that is not only transactional, only if you have money, only if you know how to pay, not only if you, it's something that's more about people that knows you and you know them and can help you to achieve health. So I think we need to understand the social justice goes also to have access to health, right? We live in a country that everybody understands that kids should go to school, right? Parents can lose their kid if they don't send kids to school, right? Protection service can come, and if you don't send your kids to school, but parents can decide not vaccinate their kids, right? So because health is not the same importance for us that other issues. So I think we need to shift to that. Health for us, and the way that we also discuss this around, think about immigrants who comes to this country and is not be able, for example, to have Medicaid and then don't have health insurance at all, because systems are not set up. If you don't have a job, who give you insurance? And if you're not eligible for Medicaid, you don't have insurance at all. So we cannot have a group of people living with us, working, right? Working our restaurants, cleaning our office, who doesn't have health care. So we need to find a way to include everybody. And I think schools is a good model. We have a system, a school system in US includes everybody, right? An immigrant parent can have their kid going to school because it's a right for the kid to go to school. So everybody should have access to healthcare, in my way. And I think could be an incredibly good movement for us to think about social justice, right? Why we don't have more people who trust their healthcare provider, who trust their pharmacist? Why we don't have better models of pharmacies as we're seeing here today, where community get together to even support them, right? We have an example here of like a community pharmacy that the community help them to help the community with vaccination. We need more of this. And I do think that the social justice that Dr. King wants, right? Because he wants racial justice in a society with social justice. because he knew those two things would go together. I think access to healthcare would be a good point for us to work together.
Well, thank you so much. I do see we have some questions from the audience, and we are getting low on time. So if you all don't mind, I'm going to ask you all one or two of them. So one of them comes from Teresa Perkins, and I will ask this to Henry. Henry, how would you encourage someone who does not want the vaccine?
I would definitely start by letting them know that I got the vaccine myself. You know, you have to lead by example, you know, so I would definitely tell them about my hesitancy, like I mentioned earlier, that I was right there in the same boat as you. You know, at first I was, like Sienna said, I was like, man, the vaccine came a little quick. Man, let's see how it does with some people first before I go ahead and get the vaccine. But as a healthcare provider, I felt like I had to lead by example. So, you know, my wife and I, you know, we got the vaccine back in January as soon as we could get it. You know, granted, it took a little bit, you know, it took some prayer, took some, you know, educating of myself to do it, but ultimately we got there. And, you know, I tell people all the time, hey, I'm proud of you. I know, you know, the hurdles that you had to get over in your mind to get to this point where you're accepting the vaccine. But I tell people, look, I got 2 arms still, I got 2 legs. I don't have magnets, you know, flying at me, you know, out of nowhere, attaching to my body. So I think once I kind of have that conversation, that one-on-one with them, ultimately they get comfortable and they then get the vaccine. So again, just leading by example, you know, letting them know that I'm genuine, you know, that again, I understand where they're coming from. It usually ends well with them actually getting the vaccine.
If I could just mention
Please
one
do.
other thing with that, something that I wind up using to kind of get my patients more comfortable with the idea is the first week that we were administering vaccines, I had an elderly gentleman who was in his mid to late 80s. He just said very frankly while I was giving him his vaccine, he said, hey, I remember being a kid, you know, and polio was out and our parents didn't know what was in that polio vaccine. They lined us up because they knew what would happen if we didn't get the vaccine. They didn't know the long-term effects of the vaccine. And so that's something that I've really used kind of in conversation with parents and patients, is that there's so many vaccines that have come down the pipeline. And because of these vaccines, we don't have to deal with some of the illnesses that we did in the past, whether we're talking about polio, even something as mild as chickenpox. Our kids don't have to deal with chickenpox, and it's because of the varicella vaccine. And so that's a driving home point. Vaccines are not new. And even though I know we talked on this earlier, the mRNA vaccine technology is not new. That is something that's been out since the 70s. So while these are the first vaccines that we're using this technology with, the technology itself is not a brand new thing. So I just wanted to mention those 2 points.
Thank you all. I really wish we had more time because now we have so many questions. So if you all, when I ask this last question, if you all want to type out the answers in the chat for some people, that would be great. But we are running low on time and we do want to respect everyone's evening. I can't thank you all enough for today. So my last question for all 3 of you, Henry, Jade, and Sayana, if you could have 60 seconds to give a PSA on COVID and the things we touched on tonight, what would you say? Let's start with Henry, please.
So in the theme of MLK, you know, Dr. Martin Luther King, he fought so hard for, you know, equality and social justice and equal rights. You know, just I'm gonna speak just from the African American male perspective. You know, Dr. Martin Luther King Jr., he fought again for these rights, you know, for us to even be at the table to be able to have access to this vaccine. And we have it right here. It's at our disposal. It's free. You don't have to pay a dime to go in here and get this vaccine. I mean, you got some people that are being offered incentives. You know, hey, you get $100 to get the vaccine through your job. I mean, they're giving you money to get the vaccine. I mean, it's a big deal. And, you know, just to put things into a different perspective, yes, like my wife said, we're in Williamsburg, where it's predominantly white. You know, our white counterparts, again, were beating down our doors to get the vaccine. If the vaccine wasn't safe and they wanted, African Americans to be guinea pigs, they wouldn't have been sitting here beating down the doors. And you're getting the same vaccine they're getting. They have no way of differentiating. Oh yeah, this I'm gonna save this vial here for the Black folks to get. That's not the case. You're getting the same exact vaccine, and it's doing absolute wonders for just everybody in terms of protection. So yes, get the vaccine.
The quote that comes to mind is that we must learn to live together as brothers, or we will perish as fools. I think that quote is so relevant for today's day and times, just as relevant as it was, before. We're talking 59, 60 years ago. And that's the main driving point that I've tried to really harp on this evening. If we don't all together get it together and come together, we are going to be in this and we're going to perish individually. And that's just so unfortunate, because we can make a collective decision to come together. And we come together by using some of the mitigation opportunities that we have, whether it's wearing masks, the social distancing, or getting the vaccine. And not just getting 1 dose of the vaccine or 2 doses, getting 3 doses. Make sure you get your booster, because even with Omicron variant out right now, they're talking about how effective those who have received their booster, how effective that is for them, where they're seeing very minimal effects from COVID. So please, let's get on one accord. That is, Dr. Martin Luther King Jr.'s dream, is that, we're all coming together. And so that's what we're trying to work towards, and not just in the disparity, whether we're talking about healthcare or racial injustice as a whole. So that has to be the main goal.
Thank you. And then Suyana, please.
I think everything was said. I feel just honored to be here. It was a pleasure to be able to debate this so important point with all of you, to know that Henry and Jade work incredibly. So very, very emotional for me to be here. And just repeating what they said, we can do this, right? We can do this together. And as dialogue is the way there. So let's keep dialoguing. Let's keep asking questions. Let's keep listening to each other. Let's find a way to have those encounters, right? As you guys organized for tonight. So thank you. Thank you for all you're doing, and thank you for inviting me.
Oh, yes, that's fantastic. I mean, again, thank you. Thank you so much, Jade, Henry, Suyana. You all were great. Nate, thank you for bringing us back to center at the beginning. And Jimmy, of course, we couldn't have done this without you all hosting this. So I would like to thank everyone tonight for attending. Thank you for your time on this wonderful holiday. And of course, again, special thank you to Rodney Miner, who did all of the technology. We couldn't have done this without you. Sumeda Sharma, who designed the beautiful flyer and the messages that were sent out. Again, Dr. Phyllis Slade Martin, and the Community Ministries of Prince George's County, the CDC team. Thank you so much. I hope everyone has a great night, and unless there's anything to add, peace out, y'all.